This video is specifically for children having issues with their speech. So what is the role of occupational therapy in children with speech issues? So before we go into that, let us first understand what speech exactly means. Speech means producing certain sounds. Producing b, m, k, d, that comes under speech. When I say communication, I mean talking with someone, understanding other person's perspective, and including yourself into that conversation. So that is communication. So communication is different, and I am going to restrict myself for speech. So what is the role of occupational therapist when it comes to speech? A child is sent to speech therapist for talking or for learning how to speak, but he should be able to sit for the session. He should have that much of sitting capability. He should give proper eye contact to the speech therapist. He should understand the commands given by speech therapist. He should be able to plan the movement of his tongue, vocal cords. He should be able to coordinate his breathing with his speech apparatus. So all this comes under occupational therapy. Occupational therapy will prepare the child for speech therapy. Occupational therapist also looks into the concurrent issues that leads to deficits in speech area for the child. So these issues can be associated with the tone of oral muscles. Now tone means either the child's oral structures, his tongue, his lips, and the other structures in the mouth, they will be very tight for the child to speak, or they will be very loose for the child to handle it for speaking things. There can be sensory involvement also. The child may be hypersensitive to any sensation, or the child will be hyposensitive to any sensation. By that I mean whenever tongue is moving, so the child may like it or may not like it, or there will be too much of saliva or water. Saliva means the water liquid in the mouth. So there will be too much of saliva in the mouth which child is not able to regulate, or there will be hypersensitivity to something that a child is eating which is not keeping his oral structures comfortable. So that sensory component of oral structures are looked into by an occupational therapist. So that is one thing. There is something called as dyspraxia. Dyspraxia means ability to plan. A child having speech issues mostly have this problem. They are not able to plan the movement between their lips, the tongue, the lungs or the vocal cords. You have to have some coordination between your breathing and your speaking apparatus. So that coordination is not there. Occupational therapists help the child in understanding how to plan the movements of the muscles. So this is called remediation of dyspraxia. So a child having dyspraxia is taken care of by an occupational therapist through his OT sessions. Once the child understands the sequencing pattern of the muscles, he does well in speech therapy sessions. Otherwise, he doesn't understand when a speech therapist is saying say "l," he does not understand that he has to take his tongue up or down or right or left, and then there is the whole chaos for the child to gain anything out of the speech therapy sessions. Uh, Higher cognitive abilities like following commands, solving the problem, sitting at one place for a longer time, giving attention to what the speech therapist is saying, concentrating on his oral structures for speech, and making errors and identifying errors, and trying to give whatever speech therapist is asking for. All that comes under higher cognitive functions. So occupational therapist is working on those higher cognitive functions so that the child knows that he has made a mistake and he has to correct it, and he has to learn the right thing he is being taught to. So this is how the occupational therapist is working when a child with speech deficits come to the therapist. Another commonly seen cases by occupational therapists are children with hyperactivity disorder, where a child is just not sitting and they have associated sensory processing issues. So occupational therapist looks into those components as well. So a child not having a speech is not a simple case that he just does not have speech. There may be many other reasons behind that, and I have enumerated a few in this video. So whenever a child goes for a speech therapy, I feel that he should once go through an occupational therapy session to find out if there are any concurrent issues, if the child can take up whatever speech therapist is talking to him. This is how occupational therapist basically helps children having speech issues.